Good evening, everyone. Welcome and thank you so much for joining us at this World Health Day 2025. I'm Mais Hussein, and I'm the co-founder and director of Across the Border CIC, and I'm honored to be here with you tonight for what promises to be a powerful and necessary conversation. So our theme of this year is health for all, and we mean all. And no matter your race, migration status, gender, background, the conversation is for you. So who we are Across the Border CIC is our mission is to support migrants, refugees, and asylum seeker communities through programs rooted in care, advocacy, and justice. Our three pillars are the rose of race, and we tackle racial discrimination and its deep impact on the mental well-being. We also have lily of age, and this one addresses how young and old migrants inequally experience health and belonging. And the lotus of gender is basically where we challenge how gender and migration status intersect to affect health and access to it. So why World Health Day matters. It reminds us of that health is a human right, but it's not always a reality for everyone. So many migrant communities face long delays or being denied healthcare as a whole, language barrier or lack of cultural understanding, and also discrimination based on their immigration status or identity. So for grounding the space, this event is grounded in care for ourselves and one another, justice by naming and challenging inequalities, and inclusion by centering lived experience and solutions from the panelists and from us all. And you are welcome here, and your story matters. So if you have any questions, please put them in the chat. So firstly, we will start this with our opening remarks, Huda Muhammad Ali. And she is, I'm honored to introduce her. She is someone who embodies all of these values that we've spoken about. And she is a safeguarding consultant, a human rights activist, and a healthcare professional, and the co-founder of the Avengers. Huda has long been a voice for those who silenced by the system of harm, and we are so grateful to have her ground our event tonight. So I will hand it over to Huda.
Hi everyone, good evening.
Hello, good evening to you too.
Hi, thank you so much for having me. I really feel honored to be part of to be part of you guys, to be part of what you are doing and being able to support. And I'm your biggest cheerleader. So thank you for having me. And yes, happy International Health Day, even though it's every day. Today it is that. So why not celebrate while we all make a difference and knock some doors down? So I hope everybody can hear me. Also, I'm not in a jungle, I'm in my house. So there's a lot of birds that if you can hear the birds singing, they just over there. So if you can't hear me, please do let me know. But yes, thank you for having me. And I think where I'm going to start today is the importance of why we are here. You mentioned earlier that having access to health, it is a human right. We are living one of the richest country in the world, and a country that that welcomes refugee people, so they said. But what is written on the paper is different what is really provided, and that's why we are here, because we need to take up spaces. We need to really make a difference, and to do that is opening the drawer, taking those papers, dusting it out, and then making it happen, if that makes sense. My mind works differently, but that's how I explain things to myself. I always say that because if you think about the NHS, right? So those of you who know me, I work in the NHS for many years. I became a nurse. I specialize in infectious diseases. I work in sexual health and HIV for, many years. And it's something that have shaped me as a human being, as a health and health professional, but also I saw the need for my people, for my communities, for those people, you know, who are not British, they wasn't born here, they are here for a reason, but doors are closed. Why are those doors closed? Because when we open the doors on NHS, who are the people who work there? If you really think about it, it's us. It is Black and brown people. Like literally, if NHS today, if we all walk away, there wouldn't be an NHS. And I'm proud to say that, because I always I say what I say and I mean what I mean. Okay, so when you look at from, you know, the healthcare, from reception, from the healthcare assistant, for the junior doctors, from, you know, student midwives, from a nurse, from midwife to, you know, all the way to the doctors, you see how when it gets to consultants, the whole dynamic changes, right? Because now it gets to that health professional who's actually in power to make a difference for people like me and you. We work, we pay our taxes, we work 12-hour shift. I did it over 10 years and I'm proud of that. So we know what is going on. Systematic racism is there and it's not going anywhere. So what can we do today? I know there's an amazing speakers coming after me, so I'm not going to take a lot of time, but what I'm going to do that I'm going to stir the pot a bit, right? So we can all later come together. So that systemic racism is there. And then who does it affect? It affects the lowest people, which is the people who can't speak English, people who are running away from war, which is actually started by the Western world. Sorry to be diplomat, you know, politician now. But you have to welcome these people. They have the right to live their life and they have the right to have an access to their health system. Sometimes these people, their children are the doctors, their children are the nurses, their children are the ones who are working in the NHS. So what do we need to do? I am proud of the young people who are already in this space, and I'm very proud of the future generation that is coming. So we're going to have to pave the way. And the way we're going to do that is knocking the doors that we are not invited. And when we're not invited and the door is not open, we keep on knocking. Because you know what happens when you keep on knocking? The door gets open. And when the door gets open, you have a question and the question has to be answered. So for you young people tonight who will be watching this, I hope this is going to be recorded as well. So if you are here in the UK, if you are watching this internationally, this systemic racism when it comes to healthcare is not just UK. It's a global issue where people who are not in the high end or rich don't have access. We need to change that because we have paid into the society. We pay our taxes and we have to make sure we get the care we needed. So for us today, we are very lucky to be here, to be having this webinar, but there are millions and millions of people, just like me and you, living right here in the UK, do not have the voice we have, who do not have the platform we are in today. So I beg you today, let's start conversation. Let's make sure that we are now involved of changing the policies. We need to get involved policy change. We need to get involved where decisions are made. It's not just for me being a nurse and doing my job. No, I want to be involved making that difference. The NHS have something called language line. And I just find out after I left NHS after so many years, they took away the language line. Language line is where the doctor have all these numbers with the different language interpreter. So when the patient in the room, if they don't understand the doctor and there's not like, if they didn't come with an interpreter, the doctor can just pick up the phone and get the right interpreter to explain what they need to explain to their patient. But because, you know, they're refugees, they can't speak the language, it is not the forefront. I am not just speaking as a campaigner, I'm not speaking as right now as a professional, but also I'm speaking as a patient. I am a survivor of female genital mutilation who needed help and support from the NHS ever since I was 21 years old. At the age of 37, I was diagnosed with menopause. And when I was diagnosed with, when it was the FGM, I didn't have doctors to understand me because you know why? What they were told was it only happens in Africa and you don't need to know this. But if you were trained as a doctor, that your patient is your first priority. But because of the skin of my color and what has happened to me, that was not priority to them. I have to step in and change that, which is why that I am proudly can say I developed the first anti-FGM performer within the sexual health clinic in my hospital, which is the one that now is being widely used. Why? Because I take space. You know why? Because I wasn't taking no for an answer. This woman that was coming here needed an answer. And we, as a health professional, need to give them an answer. And that answer was, let's change the questionnaires we ask everybody. So even when we get a junior doctor who don't know what FGM is, they can ask these questions without thinking. There is a way cleverly to do this. So I can keep on talking, as you know, right? I love talking, but what I will do is I will leave the rest of the speakers to speak, but that's what I would say today. We need to take up spaces. We need to be those people in the table when the policies are being changed. We need to talk about our people. We need to also use our profession to pave the way for the future generation and also speak up for those who do not have a voice. I came here as a refugee at 2 months before my 21st birthday. I could not speak a word of English. And today I stand in front of you as a 47-year-old woman and I done it. So if I can do it, you can all do it. Yeah. So use your voice, take its space, and don't apologize, but be respectful as well. Happy Health International Day, everyone.
Happy International Health Day to you as well. I mean, very powerful, like, and very grounding words. And I think there's nothing that I can say, but your 20-year-old self would be so proud of the work that you've done so far, and so proud of you. Like, you've come through a lot, and you've made the changes, and you've knocked down those doors, and it's very impressive. Thank you so much for being with us here today, and thank you so much for giving your time and just to be with us as well. Okay.
Thank you very much. I'm going to stay the rest and I'm going to watch everyone. Thank you very much.
Thank you. Okay, so I will introduce now Mawadda Muhammad. She's Across the Border co-founder as well, and she is she will be our chair of the panel, and she'll be introducing the panelists. And she's a co-founder of Across the Border, and she's also a operation advisor at ATT. So Mawadda, the floor is yours.
All right, thank you so much. Hi, everyone. Hope you're all doing very well. And I just want to start by thanking Huda. Thank you so much for sharing your story. It's been really touchy, and I'm sure it resonated with everyone here. Even like the language line concept, I didn't know that that was a thing in the NHS. So that's been super insightful. And yeah, we really appreciate you being here, and, you know, as like the opening remarks for the event as well. So like Mace already mentioned, she briefly introduced me, but I'll introduce myself again. So for those who don't know, my name is Mawadda, and I am one of the founders and directors at Across the Border. And I will now be chairing this panel session, which is titled Breaking Barriers in Immigrant Healthcare. And this will be basically the core of this event. So the panel is basically like a dynamic and honest discussion with healthcare professionals, community advocates, and basically those with lived experiences. So please join me in welcoming our lovely panelists for today. I'm just going to be calling them, and then Mace, if you can just add them as contributors. So we have Adekumbi Bello, Salma Jafar, Ryan Bryan, and Layan Al-Shama. So let's have them all up here. Hi, everyone. Can you hear me?
Yeah, we've been together.
Hi, how are you doing today? Lovely to meet all of you.
Hello.
Yep. So before we begin, could each of you please just start by providing a short introduction, nothing too deep, just something brief about yourself and what you do, just to familiarize yourself with the audience. So I'll begin with Adekumbi.
Hello, good evening, everyone. Okay, I'm just trying to come on my video.
Yep, we can see.
Hi, everyone. My name is Adekunle Bello. I am a healthcare operations professional. I have managed healthcare systems both in Nigeria and in the United Kingdom. I am an ex-founder. I've dabbled into the female health space. And I'm excited to be here today because what we're talking about is something I'm very passionate about. And I'm looking forward to learning from everyone here and also sharing some of my lived experiences professionally and personally. Thank you.
Right, that's amazing. Selma?
Hi, everyone. I'm Salma. I'm a campaigns and events assistant at Furnishing Futures, a charity in the UK. I'm also a recent graduate in biomedical science.
Right, very brief. Rayan?
Hi, I'm Ryan. I am the CEO and founder of Thelma Matilda Else Foundation. We're a Black women's mental health charity, so we support Black women by offering counselling and group sessions to talk about mental health and anything related to Black women's lived experiences. And I'm also a PhD student at the University of Greenwich, looking at the impact that windrush and migration has on the mother-daughter relationship. So thank you guys for having me today.
Yep, thank you. And finally, Layan.
Hi everyone, I hope you're well. So my name's Leanne and I'm a clinical genomics liaison assistant at the Royal Marsden Hospital. And I have about 3 years of experience working for the NHS. And I'm originally from Iraq, so I came to the UK when I was 7 years old, and I've got experience coming to this country as an immigrant. And I also recently volunteered in Jordan in Palestinian and Syrian refugee camps. And that experience really made me want to do more to support refugees and immigrants. So I'm really grateful for this opportunity.
That's really insightful. Thank you so much for the introductions. It's really great how, basically to hear how versatile our panel is for today, because it really fits perfectly for this event, and basically the different responsibilities that you each hold within the industry, the healthcare industry specifically. So that's really amazing to hear. Now let's move on to our first question. What are some of the most overlooked barriers immigrants face when accessing healthcare, and how do these intersect with identity, gender, or background? So I'll start with Ryan.
Yeah, so from our experience running a charity, we have a lot of people, descendants of immigrants, specifically the Windrush. So people have come in their 60s and the 50s and have come here as kids or as older adults early in their life. And a lot of things that they recap about and talk about is the fact of institutional racism and not being understood about this. I think a lot of the fear of coming into the UK and having the hope that they had to build a better life, better structure, and then being met with suspicion, racism, this ideology of that you're this weird other, the fear of the other, the fear of the immigrant. And then not having the reality match up to what the promise was creates a lot of cognitive dissonance for them. Also builds resentment on feelings of unbelonging, and then when they have this lack of trust in the system because of all the violence, the structural violence that they've been faced, then not being able to, wanting to access mental health services or believe in the mental health services, having this fear, having this lack of trust that as well of being these people are going to institutionalize me, they're going to pathologize me or demonize me, stopped a lot of them from accessing mental health. And then on the flip side, the mental health system's not understanding the experiences. So a lot of them going in and getting NHS counselling, but the counsellors are white, middle class professionals who can't relate to the story of being an immigrant or maybe Caribbean backgrounds, African backgrounds, our family setups, the responsibilities and traditions we have, and then not feeling comfortable to share, which obviously then affects the quality of counselling that you get when you don't feel safe to share things.
Yeah, 100%. Thank you so much for sharing that. And yeah, I could definitely relate to a lot of what you said as well. I feel like there's a lot of gap between race and culture and religion around the world. And I feel like within the healthcare system, there's a lack of understanding and like empathy in terms of like the way different cultures and different backgrounds, you know, their way of life is, and just having that understanding or that leniency to basically, you know, provide insight of how someone's mindset works, for example, is really important. And that's something that really needs to be looked at for sure. So yeah, thank you for sharing that. Leanne?
So the first thing I thought of was language, because in my previous role as a clinic coordinator in the pediatrics department of an NHS hospital, I would have to book interpreters for patients. And sometimes interpreters wouldn't show up, which would delay the patient's treatment because the family would show up and they wouldn't be able to speak English. So the appointment would have to be rescheduled, which would delay the patient's treatment. And I remember coming to the UK when I was 7, and I went to the dentist with my family, and I needed to have this dental treatment where they would extract teeth. And my parents couldn't understand why I needed that, and they refused for me to have it done. And then a few years later, I ended up needing to do it. So that's another example of my care being delayed due to language being a barrier. And another thing I thought of was like the fear of legal consequences. If a person's an undocumented immigrant, they might not seek medical care due to fear of being deported. And I also worked in the fetal medicine unit of a hospital as a receptionist. And I remember a woman came in heavily pregnant, and she hadn't had any follow-up appointments or checkups because of this, because she'd been migrating so much and she wasn't able to have any of these appointments. And another thing is culturally inappropriate care. So for example, if the patient's a Muslim woman and she wants to see a female sonographer or gynecologist rather than a male one, that might not be available. So she might have to wait and her treatment would have to be delayed.
Yeah, no, 100%. Yeah, you've raised really strong points in there. I feel like a lot of these points, they're not taken as serious, and they're not very acknowledged within the healthcare industry, specifically the NHS. I feel like it's really hard for, you know, like you mentioned, when a woman wants to request for like, you know, a female physician, it's really hard to get that. And also the point you raised about that fear that a lot of migrant communities face when they're trying to seek healthcare. Like even within my family, like my aunts, my uncles, the last thing they would do is go to a hospital. Like even if they're injured, it's like they just don't see it as something of like, it's not like a matter of urgency for them or a matter of like self-care for them. And I feel like that's the way they were raised. And I feel like that's the ideology that was basically sent to them. So it's really important to like have these discussions. Obviously language is a huge, huge part as well, especially in the Western world. I feel like these are things that need to be considered. And, you know, a lot of the times when you don't speak the language, you're already disadvantaged. And the fact that people aren't doing much to try and help those who, you know, aren't as strong in the English language or the lingua franca, it's really disappointing to see. And I feel like these are conversations that we need to have. So yeah, really, really great. Selma?
Yeah, I think I pretty much agree with what everyone's said. But for me, I think it's also a culture barrier in terms of, I think that people that grew up in London, for example, we know GPs and like hospitals, you have to fight for yourself. And we know that like to get a waiting booking time, even to like call in and see your GP, we know that we have to fight. Whereas with immigrants or people that don't know the system or know how bad it is, I feel like it's trusting the system and kind of being like, okay, I just need to call in next day. Okay, it's my bad. I need to think. But I realized that Karens, honestly, there's nothing wrong with being a Karen. I feel like, you know what, Karens, they had something going. Because even in NHS, I remember volunteering at the hospital and we were booking visits. It was during the pandemic, and we realized that during the time when like white people would like argue for their case, they'd be like, no, we're going to visit our family, we're going to stay with our family. And eventually the hospital would just be like, you know what, go for it. But then I realized that a lot of the time when it came to ethnic people, we'd kind of just be like, okay, we'd follow the system. We wouldn't really advocate for ourselves in that capacity because we wouldn't want to go against the system. And then on top of that, I feel like also the biggest problem is not necessarily accessing, but the thing is we're accessing a system that isn't equipped to handle us, or equipped to kind of deal with everything that we come with. So like, even when I was studying biomedical science, I remember there was this one module where we were talking about reproductive health. And one of the known facts was like, hey, we have no research on Black maternal health, but we know it's different. And that's what's causing all the deaths. And then I was like, well, why are we not learning it? This is the curriculum. I feel like there's so much that we don't know. Like, I recently went to the APPG last year, and it was all about Black maternal health and talking about how Black women are like 4 times as likely. But then we don't really talk about why it's 4 times as likely. And also when it comes to like women now going there, imagine now you come to this country, you're thinking you're going to get the best healthcare ever. And then you're kind of going to the NHS, you're not really questioning anything. You're not questioning how they look after you, who's looking after you. And then everything kind of happens and they're not equipped to handle like your case. I do think it's a big thing. The system is at fault, as well as just the access to the system.
Yeah, 100%. One really major point you raised as well is in terms of like academics and like just like other institutions that teach these things around, like, you know, like any institution within the STEM field or healthcare, for example. Like, you know, when you're carrying a book, for example, and you look at the human anatomy, like most of the time it's showcasing like quote unquote white people. So Black people do not have that representation. So just like you mentioned, like, you know, the resources are there, but they're not equipped for us, Black people specifically. Like even, for example, skin conditions. I remember I was, because I did biomed as well, and we were talking about like different types of melanoma that would appear on the skin and how patchy and like how it would like look. And they were only showing white skin. And so I was like, okay, with the same look, like on my skin, for example, how do I know that I'm at risk? And the professor didn't have the answers, unfortunately. And I feel like that's where the issue lies. And I think one of the reasons why, you know, a lot of migrants, they don't speak up also like comes from basically what Layan kind of said, like that fear, you know, because we are, no matter, it sucks to say, but we're pretty disadvantaged in this community. And, you know, if you say one thing, even if it's right, you might get penalized for it. So unfortunately, that's the situation we're in. But I feel like if we do group together as a collective, if we do have like, you know, people who can support us, you know, whether it be the white community, whether it be your friends, your family, if we just, you know, communicate with each other, if we group together and raise this situation as a major issue, hopefully it can reach the right people and changes can happen. So yeah, thank you so much for sharing that. Last but not least, Adekunle.
Yeah, I pretty much agree with what everyone has said. However, I would like to shed some light on the situation with medical records, because in my experience working in healthcare administration is one of those, it was quite a challenge for immigrants when they move from one country to another, having to transfer their medical health histories. So for example, I'll use myself as a, I'll share my experience. For example, when I was to come to the United Kingdom, I went through different series of healthcare tests and diagnostics tests just to make sure that everything is fine. But when I got here and I wanted to like present my medical records, I was told that I would have to do everything all over again because they do not accept like external medical assessments, and they would like to carry on procedures I already had done, and they would like to get their own results, which is something that was quite daunting because some of these procedures were quite rigorous. And regardless of the fact that it's been conducted before, I was being expected to undergo it once more, and it was quite a challenging period for me. But then this is for this is a situation where I even have records. What about people that they had to flee their countries during crisis, or when they had to seek some form of asylum or something, and then they come into the United Kingdom and they have zero medical histories? How are they able to navigate that situation from where they have they're like medical mysteries to the doctors, and then a lot of things get lost in translation, and the doctors really do not know how best to support these patients, and some of them are being dismissed. Some of them are dismissive of the concerns of these immigrant patients, and it's quite difficult as women as well, because, for example, our reproductive history, the complexity that surrounds women and their reproductive histories, and it being translated from whatever situation was whatever situation was available in their countries to the United Kingdom. And I feel it's an area that a lot of people overlook. For medical history, if there's something that I would like to be more talked about, or more support to be created for, would be how can we make that transition from the previous medical issue? How do we unite and create a situation where people do not have to go through the same treatment or go through the same rigorous procedures that they've already had before, just because they're entering into a new healthcare system? I think it's an area that we need to start shedding some light on, and creating the best support for immigrants, and ensuring that things are not lost in translation, and they have access to the right support for them in these situations.
Yeah, 100%. That's really insightful, actually, because it got me thinking. And I'm really sorry that you had to go through the same procedures that you did outside the UK, again, when you came here to register with the NHS. And it just, reminded me back to when I first came here for uni, and I registered with my GP. And obviously, growing up, I moved around a lot. So I went from one country to another, and they started asking me about a list of all the vaccinations that I've ever had in my life. And I was like, how can I possibly give you this documentation? That's way unrealistic. I don't know what I got, literally from birth till now. They wanted a list of every single medical checkups, every single vaccination I had, everything, in order to provide a report for me. And I was like, that is not possible. And I remember I stayed there for another 3 hours and they just dismissed me. So 100%, I agree with what you're saying. And I feel like we really need to shine light on, like you mentioned, that transition process for people who come from outside the UK in here, and, who want medical attention, or even people who simply just want to register with their GP. So yeah, I completely agree with you. And that is something to raise for sure. So now moving on to the second question, what does true cultural sensitivity in healthcare look like in practice? So this time I'm going to start with Layan.
So the first thing I thought of was patient-centered communication. So, for example, asking questions rather than making assumptions based on stereotype, like, for example, what the patient's wearing, and also being aware of and respecting their cultural practices. And another thing is aligning their care with their culture and their practices. So providing modesty and privacy, for example. And what you just said about the vaccines, the exact same thing happened to me. So I had all my vaccines when I was a baby.
I was the only one. I'm really happy that you talked about
funny,
this.
Because it happened when I was doing my master's. They made me do all the vaccinations all over again. And I just started my job in September, and they're making me do the vaccinations all over again.
Oh, really?
So, yeah. So I had one. I had an appointment during Ramadan, and I went to my appointment and I asked the nurse, can I get the vaccine done while I'm fasting? And she was like, oh, I had no idea you're fasting, poor you. And she was like, just come back after Ramadan. So I came back after, and I had my vaccine. So that's an example of making an adjustment to someone for their religious beliefs, and also providing food in the hospital that aligns to their religious beliefs. So, for example, having halal food, And another thing I thought of was inclusive language and representation. So what you were saying about like skin colors, for example, like skin conditions look different on different skin colors, and it's important to include that. Like for example, in like patient leaflets that are given when patients are diagnosed with conditions, and patient education is also very important. So those are the things I thought of.
Yeah, no, 100%, literally. But yeah, I'm shocked they're making you do everything all over again. That's crazy. But yeah, it's things like these that we really need to raise. I feel like no matter how small a situation is, I feel like even the smallest of things can make the biggest of differences. And I feel like, you know, like for example, when I got dismissed, I was like, oh, they're probably like, under so much pressure, they don't have time for me. I'm not like, it's nothing urgent or any of that. But they said they would follow up with me and they never did. And literally the entire 3 years, I never went back to that GP. Like, thankfully, I didn't get sick enough to go back. But it's like my registration was incomplete. And it's like the fact that they dismiss you that easily is just, it doesn't make any sense. And I feel like, for sure, like, I think within healthcare, there should be cultural representation. There should be, equity, not just quote unquote equality, even though that's not been reached yet. So 100%, those points you raised are really important. People can stay there, at the hospital for days, and if they don't have like access to halal food, how are they going to survive? It's not like they can just leave whenever they want, do whatever they want. These accessibility options really need to be, raised and actually put into perspective for those people in charge and make it a reality, or make them a reality. So 100%, I agree. Rayan?
Yeah, so I definitely thought about this question from a mental health care perspective. And I think one of the biggest things I think about is the fact that the mental health sector of healthcare should really center lived experience. So a lot of times the way that they want get diagnosed diagnosed with mental health disorder would be through the DSM-5, but the DSM-5 is very written from a white colonialist perspective based on white women. If you look at Freud, he analyzed and got his theory from observing white women, and understanding that the way that maybe things like depression, anxiety is going to manifest for Black people, Black women, Asian women may not be the same exactly and match the DSM-5. So I know that a lot of people, for me, from my own lived experiences, when I went to the GP for depression, he didn't understand the fact that I was doing my master's and had to go to work. But there's a cultural expectation for me and my family that education comes first. I can't drop everything I'm doing because I'm feeling depressed, but I still have depression. And for my white friends, when they went to their GP and expressed they had depression, it was a bit more, they were understanding a bit more. They were like, okay, well, you're not going to work. That matches this. It's the expectation that there's one way to manifest all of these mental health disorders. And I think that definitely needs to be dropped, and it needs to be remitted in the fact that these are lived experiences of racialized communities, immigrants that may experience things differently. For immigrants who are working on a student visa, they're going to have to go to uni. They're going to have to work a certain amount of hours. They can't just leave there. They can't just drop everything, because then they're not meeting their visa requirements. So how are they going to do that? And then you're going to tell them you're not depressed or you don't have anxiety. Things like that, I think, need to be framed and reframed, especially in the mental health sector, and have considerations around that, because it's putting a lot of people at a disadvantage when they can't manifest or perform mental health in a certain way to get the help that they need.
Yeah, for sure. I feel like this really needs to be addressed, for sure. And I think another issue is the reason why it's not happening as much is because there's also lack of research around, like, ethnic minorities specifically. And with, ethnic minorities specifically as well, mental health is not as acknowledged. It's almost non-existent in a lot of cultures. And I feel like, through generations, like nowadays, they're a little more open to it, but it's still a very, like, taboo topic within a lot of cultures. And, someone could be living their life, and from an outside perspective, you could be like, oh, you actually, you might be depressed. Do you want to get checked or anything? But to them, because they've lived and they've carried that load throughout their life, they think this is how life is. This is like basically the normal way of living, when it isn't. And I feel like these kind of things and these experiences really need to be addressed and put forward for sure. So I definitely agree with what you're saying, for sure. Adekunmi?
Addressing cultural sensitivity in practice, right, shouldn't just be limited to translations, that's language issues and the likes. I think that building trust, right, should be done through representation. So, for example, if I have a doctor or a nurse or healthcare worker who looks like me, I would feel more comfortable with them, like taking care of me, right? And also ensuring that even if they don't look like me, they're very well aware with the kind of situations that I exist in. So, for example, healthcare decisions in where I'm from, healthcare decisions are more or less like a family or an oriented situation where you do not just decide if you want to go for a surgery. It's something you have to like talk about with your family and your loved ones and see how best they can support you during that situation. But here in the UK, sometimes a lot of things are quite westernized, and the belief that it's the patient's choice to determine if they're going to have a treatment done or not. But that's not the case with many cultures. That's not the case in many cultures. So ensuring that our healthcare professionals are well aware of the diverse cultural ethnicity of the patients that they serve would help the patients to trust them better, would help to ensure that patients are not frustrated when it comes to taking these life decisions of whether to access care or not. Because when care, right, is a family decision, it's not something that you alone as a patient can go ahead to make. Of course, it's you, it's your life and all of that. We understand that. But a lot of cultures, they don't thrive on individualism. It's more of like a communal kind of thing. I'm speaking for myself and some cultures I'm very well familiar with. But in the UK, it can be quite patient-centered. It can be quite patient-focused without taking into consideration the impact of that decision on the family and on the other aspects of the patient's life. So another thing I would like to say is that recognizing that these different approaches to health decisions should be respected, right? It doesn't matter if you don't believe in it or if you don't think it's necessary, but if it's what the patient wants or if it is what works for the patient, it should be well respected. It should not be dismissed. There's some cultures or there are some religions that they do not take some form of assistance during childbirth. And to be honest, right, I understand the Hippocratic oath of always having to take care of the patient first, but sometimes these things can cost more. It could impact the mental health of this patient. So it's always very important to deal with this as holistically as possible and ensuring that these nuances are not overlooked and patients are still at the center of the care plan, right? So it's always important to carry the patient along. Always ask, do not assume, right? Do not assume that, oh, this is what is obtainable in your culture, so that is what is obtainable elsewhere. Always ask the patient to ensure that you are providing them with the care according to how they perceive care or how they believe that they are being cared for the most. So I think that that would be what I would call a culturally sensitive healthcare practice, and hopefully we can get that done in the UK. Hopefully.
No, hopefully, for sure. I think the UK is a very individualistic country, so it's really hard for them to, you know, do whatever you've just raised, like, ask the patient themselves what they're comfortable with, or try and, seek help from or assistance or support from like the family. These things I don't hear about, I'm not gonna lie. So 100% I agree with you. I think for sure that mindset of like, just having that individualism and just being patient focused is not always the correct way or the right way to provide patient care. Sometimes you do need to involve other people as well. And one thing you also mentioned about, asking the patient and see what they're comfortable with. Like, for example, if it's a Black patient, they might feel more comfortable with visiting a Black doctor because, there's a relatability aspect in there. I remember I was scrolling through Twitter once, and this Black woman, she had to go to the ER, so the emergency room, and the doctors there struggled a lot with like her hair, so she had a wig on, and they didn't know how to remove it. And they did not know how to remove it, and I think it was like hours passed until like one Black nurse managed to like enter the ER, and she had like alcohol wipes here and there, and she did 2-3 swipes, with like the lace melting foam, and it's done. So I think representation is really important as well, but it's like these minor tiny things here that can result in like big major issues just because of cultural differences or racial differences. So for sure, that's really insightful, and that is something to consider within the healthcare system. I agree. And lastly, Selma.
When I thought of this question, I thought of it from the lens of FGM, and obviously having worked at the Avengers. For me, I think true cultural sensitivity is understanding where it originated from, the history of it. I feel like recently, me and Hoda, who's the co-founder of the charity, we were at the marathon and we were speaking to 2 doctors, and we were literally telling them about the history of it, and they were like, they've never heard of it. They truly thought it was something that was a religious practice. And they were like, when you started telling them the history and the colonial background of it, I think when it comes to cultural sensitivity, it's also like when you kind of treat them as if what they're doing is so barbaric, like this barbaric practice that they're doing, they're less likely to come to for help. They're less likely to come to you and actually tell you whether there's a survivor of FGM. And kind of ostracizing them kind of tells them, well, we're just not going to talk about it. We're going to continue doing what we do. We're just not going to tell you about it no longer. And that kind of builds a bigger problem within the system. When I think of this as well, it's kind of like understanding this human being and why what happened to them kind of, and also maybe why it is happening. Also in the context of FGM, when I think of FGM and why people practice it, we were kind of looking through a list of it while we were doing a teaching seminar. And when there's certain tribes whereby if the girl isn't cut, she's ostracized completely. And keep in mind that's like the only thing. That's the only thing. Kind of imagine like getting taken out of your community and being told, "Hey, you'll survive. You'll survive." And also, I feel like when I think of healthcare, one of the oaths or one of the Hippocratic, I forgot the name of it. One of the oaths is kind of yeah, it's forgotten about it. But one of the oaths is basically doing it for the better of the patient. So obviously, you'd want their best interest, but you'd want to also understand and be able to empathize and be able to understand why they do what they do, and basically build that safe zone. If they feel like you're attacking them, if they feel like they're constantly in the defense, they're not going to come for help. They're not going to come or tell you all the details or be able to get the right support that they need to access to healthcare. So I do think it's all about, yes, having the human-centered approach, and I think that's definitely what's missing from the NHS. I think there's a big thing where we're cases to them and not necessarily human beings anymore. And I think the second that we have that human-centered approach where it's like everyone is a human being and speaking to them like they are a being, I think that would be what true cultural sensitivity would be for me.
Yeah, no, you raised some really valid points, especially towards the end when you were like, oh, we're kind of cases to them, not human beings. Like we're literally seen as numbers, literally on a spreadsheet. That's it. Because, and you know, it's like with doctors and nurses, like, it's like, can we blame them or can we not? It's like, you know, because they're also under so much tremendous pressure as well. Like, you know, you see a doctor, they're like on call for like 13, 14 hours. And it's like, you know, at some point they get very desensitized. And I think it's kind of like a cycle. So it's like, you know, a patient would come trying to like find a comfortable, safe space to try and raise their situation, their concerns, their issues. But then on the other hand, you have like, you know, a doctor or a nurse or even like the admin at the hospital, you know, giving them like a cold shoulder or, you know, treating them as like inhumanely. And I think that kind of does add to it as well. And I feel like there's also a psychological aspect to it, not just the physical aspect as well. So it's like a whole buildup of issues and situations that just keep happening. So 100%, I feel like I definitely agree with what you're saying, and these things need to be raised. But I also think it's like an endless cycle, and it's like, what is the root cause and how do we combat that is like the main question, I'd say. But yeah, these are really good responses, guys. Now on to our third question. How can community-led initiatives bridge healthcare gaps, and how can institutions better support them? So this time I will start with Ryan.
Yeah, so I am a big advocate for community-led initiatives in the NHS. I used to work for NHS Confed, so that was like the membership board for the NHS, so it's membership side. And one of the things I think that they did really well was involve community groups in policy. So they kind of worked with charities in the mental health sector and kind of had like a mental health policy group. And it was basically getting a lived experience of people who were delivering the service on the ground with a code in the community, where the community were coming to and trusting, and we're hearing the stories and the voices and asking them, okay, now that you work with the beneficiaries that we're trying to support, how can we create policies that are equitable, inclusive, and actually are going to drive change? And I think the NHS should continue to do things like that, can work with the groups, because these community groups are the ones that are doing the on the work ground, are contacting communities, has the partnership, has the reach, has the trust already that the NHS is lacking. And the NHS could really lean on that and support that by being like, okay, how do we work with these groups? How do we get in contact? Because there are, let's say, prostate cancer specifically in Black men is really disproportionately high in Black men, but it's also because Black men don't get their prostate checked. There are Black men groups that they could tap into, like 100 Black men that could go out and advocate to Black men in their cohort that they already speak to and be like, you need to go and get your prostate checked. That can be an inter-community conversation that can also eradicate and decrease healthcare inequalities by going to the community and asking them to have these conversations in-house with people that they already trust, people they look up to, and people that they will be like, okay, you're telling me this, I'll go now. And I think that work and that bridging the gap definitely needs to take place more in the NHS. I know it happens in certain NHS trusts where they do. And for the mental health sector now, we have PCREF, which was brought in by Dr. Jackie Dyer, who used to work for the Mental Health Foundation. And within PCREF, they have to, which is the patient race equality referral framework. They have to send our community and prove, NHS trusts have to prove that they are working with community groups and patients in creating anti-racist initiatives and driving anti-racism within their organizations. So I definitely think there is work taking place. It's just about pushing the boat a bit further, I think.
Yeah, 100%. Honestly, I feel like these things can really help bridge the gap for sure. I feel like community-led initiatives, community-led groups like the ones you were talking about are really important. And I remember I mentioned the point before, like, for example, when it comes to like, you know, different cultures or like Black people specifically, for example, like, you know, in my cultures specifically, when someone hears like, oh, go to the hospital, it's an immediate no. unless you're literally on your deathbed, you're not going to the hospital. They hate it. But you know, when you have those community-led groups, for example, and someone recommends them to you, as someone who's like, you know, from that culture, you might be more inclined to seek support from there than, you know, when someone goes like, oh, go to the hospital, go see your GP. So I feel like when having those initiatives and actually speaking about them and with them growing, it would really help us and help our own community and our own like cultures as well. And I think when you're working with like a big organization like the NHS, it does make it very easy. And as you mentioned, it's just a matter of like pushing that forward and, you know, speaking more about it and just like, you know, putting in the work and the action in order to put everything into fruition, basically. So yeah, that's really helpful and really, really insightful. Selma?
But when I think of community-led initiatives, I think of, again, in the context of like FGM and working at the Avengers, I think about how we get our ambassadors and like actual survivors to go back to the community and educate them. Because one of the things we realize is if we were to go ourselves, it would be an issue of we're just coming from the Western lens as if we're better than them. When in reality, what we need is people from those communities being like, hey, this is what I learned. This is why it's working for me. This is like people from those communities coming forward. Because I think a lot of the time it's them and us, if you get what I mean. And I think that's the biggest problem. Whereas we don't see issues as a collective. And I feel like we always kind of are always in the defense when it comes to healthcare. So like with like a lot of my family members, like I remember my dad when he had high blood pressure, it'd be a thing of, I'm not going to the NHS, like I'm fine, I'm breathing still. But I think it's a thing of, they think that like if we were to go, you're bringing Western views. So many people back home didn't need it. There's no NHS back home, but some of my grandparents lived to 100 and something. So I think it's still having that approach where it's like you're looking down at them. And that's why I feel like community-led approaches are amazing, because if someone from your community was to say it, you'd listen to it differently. And sometimes it's not about what's said, it's about who said it. And I think that's one thing. Like right now I'm a campaigns assistant, and one thing we're learning about campaigns is everybody takes information from someone they trust, someone that they feel comfortable with. In reality, we don't have that comfortability with the NHS yet. We don't have that, we don't feel safe with the NHS. Whereas with our community, we automatically have that safety net. So when they tell us things, we're automatically going to take the information much better than if like a doctor was to tell us that's not from our community, like a white doctor. So when I think of community-led, I think of that approach of people directly going to the community who have kind of seen. Yeah.
No, 100%. I agree with you. That point you raised about like it doesn't matter what is said. What matters is who says it. I feel like that really sits deep, because like, you know, when you see a familiar face, when you see someone that you can relate to, it kind of puts you in like a comfortable position, and you feel more inclined to raise the issues that you have. And I feel like with these community-led initiatives or these community-led groups, when someone has gone through what you've gone through, and they have these personal anecdotes of what they have done to better themselves, or what did they do, who did they reach out to, what connections did they have, were they alone, were they by themselves, how did they get through, you know, certain issues that they faced, or, you know, whether it be like racism or bigotry, whatever it is, like how did they manage to overcome that? When you hear those like anecdotal references and like, you know, you hear those stories from people that look like you or people who have struggled the same way that you did, you're more inclined to seek the you know, correct form or the proper care that is best for you. So I feel like, as you mentioned, both of you, Ryan and Selma, like, you know, these community-led initiatives, they're really important. And I feel like at times they're better than, you know, it just coming directly from the NHS. So 100% I agree. Adekunle?
Community-led initiatives are quite important for addressing healthcare gaps because they often address systems or situations that formal systems would miss, right? And the NHS is quite large. The NHS is not specifically designed for some ethnicities, and when we have informal community-led initiatives amongst immigrant communities, it helps them to develop a support network, like you said, where people who have gone through the same situations or who have experienced the same issues that you're dealing with, and they've walked the path, right? And they understand what the situation is, and they can guide you on what kind of service you would need, who you should speak to, and just give you like information and tips on how to navigate the situation. And I feel that it's more or less like watering existing seeds rather than planting new ones. That is what is currently obtainable in the community. How are these immigrant communities currently navigating this situation? And then build on what is existing and offer support systems and probably access to technology, right, to ensure the reach of these informal-led community initiatives, right? And I believe that these organic networks can provide general health information, advice, sharing tips, and also basic and modest resources to the communities that they exist in. And one thing that is also quite important is ensuring that digital technology is leveraged to ensure that these community-led initiatives are reaching the right people, the people that they are designed for. Yeah. And the formal systems are not trying to encroach into these spaces. So people are allowed to be who they are, how they like in their normal, like in their natural spheres, without having to add some other like medical jargons and all of those things that they can't relate to. If I see someone who has walked the path, if I have someone in my community or in my environment who I feel like I trust, and this person is sharing with me that I should explore some healthcare initiative, definitely I would listen to that person rather than someone that I do not trust or someone that I feel like they cannot relate. And this happens a lot of times, especially in mental health situations where people, especially people from like countries like my country, Nigeria, we're not very open to expressing like situations that are surrounding our mental health. They see a lot of stigma surrounding mental health and mental illness. But if we have somebody in the community who we can relate to, who has walked the path and who can share their journey, definitely it would be more easier for us to access the care that we need through those community-led initiatives. And I feel like more formal systems like NHS, they shouldn't encourage on this. Rather, they should support what is currently existing and probably provide funding for it to ensure that they are meeting the needs of the communities that they serve.
Yeah, for sure, 100%. I feel like, you know, when you see someone that, like I mentioned before, you know, that looks like you, that you resonate with or relate to, it's a bit more easier to try and, you know, seek the correct form of help that you require. Because when you think about it, the same methods or the same, you know, healthcare process might not work for every single person. People come in different, like, you know, shapes, sizes, skin colors, different backgrounds. It's really hard to try and pinpoint one sort of quote unquote anecdote to everyone. And I feel like there's an issue where, you know, if like, let's say a person of color, like let's say me, I go and, you know, one of my friends just says like, oh, refer to your GP, ask your GP for a referral for this process. And I go and I seek for that referral and I get it and I go through that process and it doesn't work out for me, but it did work out for my friend. I might be like, oh, there's something wrong with me. And, you know, I might like, you know, have issues. I might just start blaming myself. I might be like, oh, I'm not normal. I have issues with myself. I don't, and, you know, that could, you know, keep me back or hold me back from seeking the right treatment that I require. And I feel like with like the NHS, that is very like, it's a very strenuous like position that the doctors are in, especially considering the fact that it's free healthcare. So, you know, oftentimes doctors, they tend to like dismiss what the root cause or what the actual issue is that a patient is going through. So, you know, it's really easy to like, you know, get recommended stuff. But when you're with people who have similar experiences to you, or people who look like you that went through the same issues that you've gone through, you're more inclined to reach the correct treatment or the right process. So yeah, 100%, I agree with all the points that you've raised. Last but not least, Layan.
Also, it says Huda raised a hand. I don't know if you can see that.
Oh, I did not see that. Mace, are you able to? Actually, let me.
I've done it.
Oh, okay,
Yep.
perfect.
Is here.
Hi, Huda. I think you're muted.
Oh, okay.
Yeah, perfect.
I'm just quickly going back to something Ryan said. I hope I'm pronouncing your name right, which is when we talk about, you know, especially Black men, why, you know, and prostate is something that we do have. You know, there's a lot of problem we have in the UK when it comes to that, right? But when we think about what is actually causing, and I was talking, you know, we all have family, we all have men, like we talked about it, why they don't go, but they don't have trust in the doctors, right? There is no trust, and also the GPs, because that is the first point that when you are sick, even from a child, that you actually get the knowledge. So going from here also, it's like a question I'm putting into the universe right now, is that our GPs, our general practitioners, need to do better for the younger generation, especially Black boys, because if they provide that knowledge they need about their health, about their bodies, then they wouldn't lose the trust, right? And also when they need for certain tests, they will go the same way as a woman. Every 3 years we get a smear test done, but there are a lot of women don't have it done. So I just wanted to add to that how do we build the trust within our general practitioner for our younger generation, especially with the Black boys, to understand, so it's easy for them to go for prostate. You know, it's really hard to get a Black man who is matured and grown to the doctors. So I think also answers lie in that. I just wanted to put that out there.
Yeah, 100%. And yeah, that's a really great point you raised as well, Hadel, honestly. I remember during my final year of uni, I read somewhere that prostate cancer specifically, it affects the majority. I think it's like close to 90% or maybe more. I'm not entirely sure of the statistics, but most of the people who are affected are Black men. And the issue is there isn't enough research to basically back up or see the root cause of the reason why Black men are the most affected. And I feel like this is a really serious situation, because prostate cancer is no joke. It's one of the deadliest cancers. It's really horrible. And I feel like with the whole seriousness of prostate cancer, considering the fact that, you know, the death rates and the risk of it is so high, and the fact that our fellow Black men are not seeking the you know, the checks, or like, you know, trying to take care of themselves to go forward and all of that, it's really sad to hear, because I think it does come from like that ego aspect, or like, you know, the way they were raised, and also the lack of representation. So 100% I agree with what you're saying, and also the point that Ryan mentioned as well. Yeah, thank you for raising that. And yeah, back to you, Leon.
So the main thing I thought of was providing trust. That's because community members understand the immigrant-specific needs, the cultural context, and also the barriers to care. And their involvement can build trust and boost participation in health programs. So, for example, like mental health in the Middle East is something that's very stigmatized. And these community-led initiatives can support people and also normalize treatment. Like, for example, if someone needs therapy or to go on like antidepressants, they can help them realize that it is quite normal. Like, we all suffer with mental health at different parts of our life. And institutions can support them by funding resources. So, for example, by providing grants, supplies, and also access to space to support public health efforts.
Yeah, 100%. I think having the community, but also having the resources is really important as well. You can talk the talk, but you need to also walk the walk, you know? So I think that's really important. Another point you mentioned about the Middle East as well, the fact that mental health is very stigmatized. That's 100% true. I feel like a lot of people, like families, you know, because I lived in the Middle East a lot as well. Like, you know, some people, they don't even acknowledge mental health as a thing. You know, it's like it's non-existent almost. So I think having those community-led initiatives, introducing those, having those talks, those chats, is really important to try and, you know, basically solidify the concept that, okay, just because there's something a little bit off about you does not mean that there's something wrong with you. We can talk about it, you know, providing that safe space, like Selma and Ryan mentioned, you know, like having those conversations is really important. But I think the issue is like, how can we start those conversations? Because, you know, sometimes you say something, but it can be dismissed. And I think that's one of the struggles that a lot of people are facing as well. Like sometimes you might raise an issue and it could, like, you know, could either get dismissed, or they might be like, oh, you're just making this up, you're faking it, or you just want attention. So I think that's another issue to also be considerate of. And I feel like these are things that we can really talk about and try and navigate when building these community-led groups. So yeah, I definitely agree with you. And I think this is really a huge issue that can be addressed, because you know, one tiny problem can develop into a huge thing, which could have been avoided at early stages. So yeah, it's just not talked about. But yeah, we need to like remove those stigmas, really. And yeah, moving forward to our last and final question. So if you could change one healthcare policy to make it more inclusive, what would it be and why? I will start with Adekunbi.
Thank you, Merit. It's a no-brainer for me, really. It's one policy that I would like to change, right, would be to implement a standardized medical history transfer system across borders. I know that this can be quite difficult because some of these things might be fragmented, right, from where we are coming from. But if it's possible, I would like that all medical histories are brought in, right, in one piece, and they are recognized, and they are used for continuous medical information, because it's quite necessary to have that historical background before you start treating a new patient, because without this, a lot of things are lost in transit, right? And this situation can also lead to duplicated tests, like I went through, missed conditions, and then fragmented care as well. So, but if this change is being implemented, it will improve safety, it will reduce cost of having to run the test all over again, and then it will also dramatically improve continuity of care, because it's always important that whoever is managing a new patient would have the medical history of that patient, and then it helps them to give more informed care and provide the best care possible for this patient. So if there's one thing I would change, is ensuring that medical histories don't get lost in transit when we migrate.
Yeah, I agree with you. I feel I could be wrong because I'm not really familiar with the whole topic, but I'm pretty sure with like there's a universal way to dictate like someone's criminal history. So I feel like the same could be related to like
applicable.
Yeah, I feel like, you know, because we have technology now. It's 2025. We've advanced so much in such a short amount of time that I feel like surely there is a way we can develop a system, a universal system, where maybe through a huge organization, whether it be the UN or any other humanitarian organization, develop a universal system where people can have access to, or healthcare industries can have access to people's medical reports or their medical history, because I think it would really help. Like someone might come and they might have like a medical emergency, and the doctors don't have the medical history to help support them, and it might be too late, or it might not end up being a positive result. So I think 100%, I'm pretty sure we can do that. Maybe it might be expensive, but that is something that should definitely be something to consider for sure, because I think it would help avoid a lot of the issues that we are facing in today's world. So yeah, that's a really good point you raised. I will then move on to Layan.
So one thing I would do is make interpreting services more accessible for patients, like possibly using AI, which would hopefully make it more reliable and accurate. So I was talking to my manager at work about this today, because she's from Brazil and she used to be a Portuguese interpreter for patients at the hospital. And she suggested using like an iPad that maybe patients can use. They could like speak into it, and it would be more reliable than a person. And I remember when I would book interpreters as well, sometimes they wouldn't be available at the time. Like for this one language, there was only one interpreter available, and they would never show up to the appointments. Yeah, so there was this patient that would always come and the interpreter wouldn't show up, and their appointments would have to be rescheduled. So that's one thing. And another thing is interpreting is very important for getting patient consent for certain things. Like in my role, there's something called HRD testing, which is a clinical genomics test that's used for cancer. And a lot of the time, patients that don't speak English need to wait a long time to give consent, which delays their treatment. So that's another thing. So hopefully using AI would help interpreting for patients.
Yeah, we have these technological advancements, and it's like it's not utilized as much by the healthcare system. And I feel like something as simple as using AI for language, it's an automated process almost. AI basically takes over, and I feel like something as easy as that can really help. People who come from different backgrounds or who don't necessarily speak the language of the country they're in or they reside in. And I feel like you mentioned that example of that one patient who had their appointment rescheduled is because the interpreter wasn't there. I'm pretty sure their appointment, wasn't rescheduled for the following day. It was probably like weeks in advance, which is really sad, because it delays their healthcare, and that puts them at greater risk as well for seeking the correct medical care that they need. And I think that's something that's really crucial, and it just stems from one tiny thing, which is like, having that interpreter present, or even using the use of AI. So I feel like, AI has grown so much over the past few years. It's almost scary to me personally, but I'm pretty, I've heard so many stories of even medical doctors using AI to diagnose patients. And, it is growing, but I feel like they should also use AI for the benefit of patients in other aspects as well, not just for physicians. So like you mentioned, language is a huge thing. And yeah, a lot of people, they don't realize that there's so many languages in this world, and the world doesn't just revolve around the West. So it's a fact. So it's like, they look at you and they're like, oh, you don't know English, so that means you're less than, which is totally not the case. But yeah, that's an amazing point. Thank you, Layan. Ryan?
My answer is a bit of a cheat. I don't think so. It's kind of more that I would implement harsher targets on the NHS to reduce healthcare inequalities. I think the King's Fund put it that healthcare inequalities cost the NHS between £5 and £7 billion a year to deal with. So it's an incentive to change it, to address it, because it will save us money. The NHS needs the money. Imagine £5 billion being able to pump back into the NHS rather than spending it on tackling healthcare inequalities, court cases, or things, etc., like that. And I think having those rigorous targets will address things like maternal healthcare, maternal death, the maternal black death, prostate cancer inequalities, breast cancer inequalities, language barriers, because these are the things that are causing the wider healthcare inequalities issues. So I think having those rigorous targets would push people, incentivize the NHS and motivate them legally to do the work that they need to do.
Yeah, no, 100%. I feel like actually like advocating for these kind of conditions and policies are really important as well, especially for people who are underprivileged or people from like a minority group. I think because a lot of their health issues are not as considered or as prioritized. So I 100% agree with you. I didn't know that number was that big. That's insane per year. That's insane.
Yeah, yeah.
I sometimes wonder, like, the money that's invested in the NHS, like, there's nothing to show for it. Where is that money going? But yeah, that's really interesting to hear for sure. And I feel like implementing these restrictions, having these basically these goals and these standards would really help push the NHS for sure towards the right direction, especially when it comes to considering migrant communities. So yeah, that's a really good point to raise. Thank you. And last but not least, Selma.
From the FGM lens again, I would say asking every woman whether she's a survivor of FGM. If that's one policy I'd put it in all GP forms. Recently, Hoda and I, like, again, at the marathon, we were speaking to the doctors, and one of them was like randomly, oh, it was on my form. And she didn't think twice of it. But right now, it's kind of like a case-by-case basis where it kind of feels like a target. So they'd be like, oh, you're from this place, you must be subjected to FGM, I'm going to ask you. And then I feel like that puts a lot of people on the defense. And sometimes it's kind of a thing of, well, now I'm not going to disclose it because now you kind of, I feel like I'm being attacked. And if it's just a checklist, like kind of asking, are you pregnant? Kind of, it's quick. Are you a survivor of FGM? And it also opens up the conversations for people. Right now, the last time we had like a full data was 2022, I think, when they said there was 230 million girls right now who have been subjected to FGM. But we really don't know the numbers in the UK. We don't know the statistics, how many actual survivors there are. There's so many people I know personally, like family members, who haven't disclosed yet. And it's a thing of, we're not asking the question, we're not asking every woman. So I wish that, like, if every GP or every healthcare facility was to ask, are you a survivor of FGM? Just simple checkbox answer.
Yeah, no, 100%. That's really important. And I feel like that's something that should have actually been the case a long time ago, not just now. And I feel like, of course, like when it's a tick box, like, exercise kind of, people are more inclined to answer it. Some people, they might be hesitant. They might be like, oh, I don't know where this information is going, or whether I might be treated like, less equal than someone else if I wasn't subjected to FGM, or if I wasn't a survivor. So there are obviously some downside to a few things, but I think when something is for like the greater good and it does help us combat the real issue, then it is something that needs to happen. And I think that's a start or a first step towards something great. And I think 100% it needs to be acknowledged. Like you mentioned, if no one asks the question, then we wouldn't know. So yeah, I agree 100%. And yeah, that is basically the end of our panel. Thank you so much again for contributing for this, each and every one of you. You all have raised really amazing points, and I really hope that the audience did resonate and did take something away from everything that you have mentioned and all the points that you raised. So thank you so much for contributing, and thank you so much for being here. And again, yeah, happy International World Health Day. And yeah, I will pass on to Mace.
Thank you so much. And again, thank you so much, Mawadda, for chairing this conversation, and for our panelists for holding the space, and so much care and clarity that was brought on. And I think from what I've learned and everything that I've heard so far, I feel the system needs to be held accountable for everything, but also we also have to work on ourselves to go out of our comfort zone a little bit to make sure that we are educating ourselves. For example, like we come from backgrounds where maybe mental health is not spoken about. Going to the doctor is basically the last resort. We should also work on making sure that we are making the first steps of being like, no, actually I have the flu, I don't feel well, I'm actually going to go to my GP. If I'm not feeling well mentally, there's nothing wrong with seeking psychiatric help, and it's not shameful, and you're not crazy. We live in a society where it's so much more accepting, so why not take advantage of that and start to like basically learn a little bit and open up a little bit as well. So thank you so much for the panelists as for the examples and their lived experience that they've shared with us. So for the closing remarks, I would like to welcome our speaker, which is Ryan, and she is, as she introduced herself, the founder and the CEO of the Matilda Ives Foundation, and she's a powerful advocate for mental health, equality with Black and marginalized communities, and her work honors the legacy of her mother and the struggle of many families that continues to face in access of healthcare and mental health. So Ryan, Mike is yours.
Thank you. So thank you to Cross Borders for organising this powerful event, and my fellow panelists for sharing their experience. It's been an honour to hear your insights, your experiences, and the depth of knowledge you've been able to bring to the conversation. I'm leaving this space feeling empowered and motivated and wanting to keep pushing for change. So when I was asked to offer some closing reflections, especially through the lens of my family's experiences with immigration and healthcare, I was reminded of Ian Patel's book, We Are Here Because You Are There. I think the title really encompasses and says it all. I'm here because the British Empire was in Jamaica. My grandparents came to the UK in the 1960s as part of the Windrush generation, and they were full of hope and opportunity and wanted to do better for their family. But when they came, that didn't happen. They were met with suspicion, racism, and the harsh reality of being the scary migrant other. Immigration, even back in the 50s and the early 40s, was demonized, it was pathologized, and the legacy of fear and the othering shaped policies that we know now, like Theresa May's hostile environment policy, which has continued to have impact on the access to the vital services that we need, healthcare services. My family's experience reflect on this in itself. So despite facing anxiety, isolation, depression, and a deep sense of unbelonging, challenges that many migrant communities face, not only just the Windrush community, there was very little understanding of this, nor willingness to understand about the emotional and mental toll of immigration, the long separations between parents and children for the Windrush generation. Many parents left their kids in the Caribbean for years, several years. The dislocation, the trauma of starting again in a brand new country, a country that doesn't want you, is deeply unwelcoming. None of this is factored into how services are delivered or were delivered back then at the NHS's inception or delivered now. And that meant my family often didn't feel seen, heard, or felt safe to ask for help when they needed it. And they didn't. And that created a lack of trust that permeated the Windrush community and many migrant communities. This was shaped by institutional racism and exclusion, which meant mental health specifically as well from this perspective. Needs were hidden and unmet. And for this reason, I founded the Thelma and Matilda Ives Foundation. So it's named in honor of my grandmother's legacy, in honor of my grandmother. She made enormous sacrifices to come to this country and build a better life for our family. And I wanted to create something that really honored her legacy while responding to the needs of Black women today. The foundation exists to offer a safe and culturally competent space where immigrants and descendants of immigrants don't have to over-explain who they are, what they're going through, and a safe where we truly feel believed, supported, and centered in our care. The healthcare system in general has a long way to go. it must become truly inclusive and actively decolonial, embedding the lived experience of migrants and racialized communities in its frameworks, policies, and practices. Because if we're serious about justice and equality and equity, we must design a system that doesn't just treat our symptoms, but acknowledges and dismantles the structures that cause the harm in the first place. And let's be clear that this country would not be what it is today without immigrants, without the sacrifice of immigrants. Without our labor, our culture, our resilience, our care, the very fabric of British society would unravel. So thank you again for holding this space for these conversations. I really want to keep talking, conversating, and challenging the healthcare system to build a future where we're truly seen and supported. Thank you.
Thank you so much, Ryan. And I just want to say that thank you so much for your vulnerability, your wisdom, and your call to action. And before I leave you all at the end of this session, I'd like to leave you with a couple of words. Healthcare justice does not start in institutions. It starts in rooms like this, and with people who care enough to question systems, to center truth, and to push for change. So let's continue working together to push this, and we can challenge inequality wherever we see it, support grassroots migrant-led organizations, and never stop believing in healthcare. And also that never stop believing that healthcare can and should serve everybody. So thank you so much for joining us tonight. And I hope that this panel was enlightening and it was as informative as it was for me. So thank you so much, you guys, and enjoy the rest of your evening.
Yeah, enjoy, guys. Have a great day. And
Happy
here's to a better future.